to Galen University's podcast. My name is Dr. Christia DeGare, the MSW Program Coordinator at Galen University. I am so excited to be here tonight with our wonderful guests talking about caring for the caregivers, mental health of frontline workers. Welcome to both of our guests. Thank you for being here. Could you start by sharing a bit about your background and your connection to frontline work or caregiver mental health?
My name is Onando St. Bernard. I'm the counseling coordinator for the counseling services unit under the community rehabilitation department. I've been working in the ministry for public service for close to about 10 years or more, 15 years, sorry. And I have been working with the frontline workers. I've been working with the very caregivers. So I'm excited to have this conversation about what it means to look after the caregivers.
Hi, everyone. My name is Marcy Martinez Carballo, and I am a social worker by profession. I was once a social worker doing direct practice within a small program called the Helping Adweavers program, where I worked with young girls, teen girls, and they were from various backgrounds. So I did direct practice with them for about 6 years. And then I moved into the government where I was working at a middle manager level, where I directly supervised social workers who provided care and client services to young people. I was doing that for about 8 years. And so my experience within the caregiving field has been around that, as well as on a personal basis within mentorship and youth groups and so forth. So, yeah.
Excellent. So a lot of experience between the both of you on the ground social work, working with other social works and other vulnerable populations. So really understanding who are the caregivers and why do we need to care for them is so important. When you think of that title, caring for the caregivers, what does it mean to you personally? And who are we talking about here? Who are these caregivers?
When I think about caregivers, I'm thinking about people who provide care to someone, whether it be within a professional setting or whether it be on a personal basis. When I think about caregivers, I think of persons who really put themselves in a position to provide aid, services, just doing some of the hard stuff, I would say, that not most people would gravitate towards. So I'm thinking about social workers, I'm thinking about nurses, I'm thinking about those who provide care for persons in institutions, whether it be juvenile institutions, whether it be the elderly home. So I believe there's different types of caregivers, and what they bring to the table is very unique, but it's also very much hard work, I would say, because it takes more than just physical. It's the emotional, the mental. It's just all of that.
Really sounds like those roles in which we are caring for others, whether professionally or personally. If you are a caregiver at home, taking care of a family member can not only be physically taxing, but emotionally taxing. And it causes a lot of internal stress, it sounds like. Onando?
Yeah, working in the public sector, working for the ministry, we're definitely looking at social workers. We're looking at our partners, right? Who we partner with being the therapists, those in the legal space as well, the medical space, police officers, teachers, and the very parents that we work with as well. Because as Miss Marcy had mentioned, it's also working with family caregivers as well. So it's important that we are able to ensure that these very caregivers are looked after so that they can do the very work that needs to be done for the very vulnerable populations. because in many ways that these frontline workers, if they're not able to do the work, if they're not well enough to do the work, then in many ways, who else is going to do it, right? So looking at caregivers, it's definitely, I agree with Ms. Marcy, the individuals who provide that care, and it's physical, it's emotional, and many of these workers as well, they will be dealing with a lot of trauma. And so that mixes into, I think, the conversation that we're going to have today about how do we ensure that these caregivers are doing well so that we don't have them get burnt out or face that compassion fatigue.
Wow, some really important words you used there. I'm hearing burnout, I'm hearing compassion fatigue. And I think for some of us, it may be some phrases we've heard, especially since, if we can think back at least 5 years ago now, 6 years ago now, during the COVID-19 pandemic, we started to hear these words, right? We've heard burnout and compassion fatigue. Some of us may have never heard of these terms. From both of your perspective, what do these terms mean?
Oh, burnout has been one that has been said. I think I'm hearing burnout a lot, especially since COVID, like you said, Dr. Krisha. And for me, burnout means you are literally at the point where you can't give no more of what it is that you're supposed to be giving or providing to those that you're providing it to. So if it's service, it can be even within the family structure, a parent being burnt out. It could be within the workspaces, you providing care or service to clients or your staff or whatever the role is. Burnout is just reaching that point where it's like you can't function. You can't give what it is that you're supposed to give or what is being expected from you. And it's also, I feel like it's also a place where you even don't recognize yourself. In some regards, it's like you're just operating on what they would say fumes. It's like, it's just literally staying active because maybe you have no other choice. But if you are really to cut you open and really dig deep, you are literally not well at all. So I feel like it's a person who has reached that point where they can't go anymore, and it starts affecting their health, physically, mentally, emotionally. It starts showing up in their interactions with people, how they speak, even how they think. And it's not a healthy place. It's really not healthy at all. So, yeah.
Definitely sounds like. Oh, go ahead, Onenda.
Sorry. Yeah, I totally agree. It's that mental, physical, emotional drain where the individual's cup is just empty, right? And it's important to understand that the very work that we do, there's a lot of times high stress, and it's that repeated exposure to trauma. And realistically, you're looking at a work environment that can be quite toxic as well, right? And from my experience, a lot of people would say that it's not the clients that we're working with, it's more the work environment that they're in. And so it's all of these things coming together, causing that burnout, as Ms. Marcia had mentioned so well. And then, also leading into that compassion fatigue where things are constantly happening. It's becoming so overwhelming. And at some point, it's where it starts to spread outside of work into, their personal lives. So it becomes so overwhelming that it seeps into their personal lives. And their thoughts and everything else happening outside of the workplace. And that's where you see that, a lot of the different symptoms start showing up, right? Something that Ms. Marcy mentioned, with the relationships and things like that start to get affected, and work productivity goes down and all these things. So, it's something that is so very serious. And if it's not caught early, can lead to the caregiver suffering, right? So we have that mindset that we have to look after our clients, but the caregiver starts to suffer. And if the caregiver starts to suffer because they have that empty cup, right, they're not able to provide the care to the very clients.
I also feel like, following up with what Ananda said, the caregiver suffers, but then it creates such a huge ripple effect whereby it starts affecting everybody else within close proximity of that person. So it's like you re-injure or you injure people in a place when you're burnt out and not able to step away and take care of yourself or get the help that you need. So burnt out, it's very serious, and I don't think it's a conversation that we have enough, or I don't think it's something that we really acknowledge to the place where it should be, because a lot of times we applaud people working themselves to the ground and calling it strength and calling it drive, zeal, or sometimes even saying it's passion. But I think rather than acknowledging for what it is and the serious effects that it has, I think sometimes it's disguised or masked as something good. So I think go ahead. Yeah.
Sorry to cut you off. Didn't mean to.
Okay.
I just wanted to say that something that I hear so often, you touched on it, something that I hear so often in the workplace is I'm passionate about it, right? The work has to get done, stuff like that. And I've been calling people out recently, and I've been saying that, you know what, that's not healthy, right? Okay, sure, we are in this profession, right? Because we feel like we have a calling and whatnot, but when we start saying, you know, I'm passionate about it, so that's why I'm here, it's like an excuse, right? To keep driving and keep grinding, even though we need to take a break, we need to stop, or we need to advocate for more resources, or we need to advocate to change the structure, or we need to advocate to have a better structure when it comes to supervision so that we're looked after as well. So it's very interesting that you mentioned that, because that's something that I have been calling people out recently on, that, you know, this thing about, oh, I'm passionate. Let's analyze that. Let's reassess that, because, you know, is that just at the front to say that, okay, this is why I need to keep grinding. This is why I need to keep going. And then I've also heard people say that, you know, unfortunately, I've heard people say, okay, so you chose this profession. You knew what this was going to be about. So if you can't handle it, you need to leave. I think that's just so disheartening. It's so disheartening, because it's not seeing the caregiver for who they are and what they're going through, and thereby putting things in place to help them work through the burnouts and the compassion fatigue.
Excellent. You know, it really sounds like this burnout and compassion fatigue is not only something that we experience at work, but after a while, it seeps into our personal lives and our social lives, and it negatively affects those as well. I often tell my social work students at Galen that our tool of the trade is ourself. Just like a construction worker or a carpenter would keep those tools in shape and take care of their tools, we have to do so for ourselves. We have to keep ourselves healthy so we can show up every day and be passionate and do the work we enjoy, but in a healthy way.
Yeah.
Absolutely.
Yeah, I think that is something very key. I think a lot of times, I think it's also something within the culture. And it might have been a learned behavior because of what people have endured. Like, you feel like you have to always maintain this strong front, or be strong, or not show weakness, or even be able to advocate for yourself when you're really feeling well, because you fear being judged or rejected or treated differently, because you have said that you're not well or you're feeling this way. Especially within the workspaces, I don't think we give room sometimes for people who are actually crumbling. And with caregivers, it's such a tough. I don't want to say profession, because it's more than it takes different roles, right? But what caregivers bring to the table or what they have to put out, it's not what everybody is willing to do. So we have to acknowledge that people will reach a point, especially if they don't know how to navigate whatever is happening within them, or they don't even know how to identify it. Because that's something we have to talk about. Because sometimes we could be feeling some things, but we don't even know how to name it or how to express to somebody else that we're feeling it. So we keep going because we don't know how to put language to the emotion. And I think we also do ourselves an injustice in some regard, but that's why I also believe so much in awareness. I believe in these kind of opportunities where you talk about the stuff, so people can be able to say, "Oh, wow, I can relate to that. That's what it means," or, "Oh, that was what I was feeling all along." So you put words to the emotion. So it's something that we have to keep having a conversation about. So a lot of times people can't name it. They can't advocate for themselves when they're feeling it because of a lot of fears within them, fear of losing income, fear of not being understood. So there's a lot of fear that comes attached with these things. And some people don't know how to navigate it. So I believe what I was trying to communicate is that I believe we have to come to a place where we're able to learn and identify what it is, and then be able to speak on it or speak out about it or speak up for yourselves regarding it.
And I think that with everything that you said, which is so on point, it's the offices, the organizations creating that safe environment, right, for the caregivers to be able to speak up and to advocate and things like that. So it comes down to things like, peer support systems, having that structure, right? Having reflective supervision, changing how we do supervision. Supervision should not just be where we go in front of our supervisor, we sit down and we're just having conversations about case management itself. It should always be checking in on mental health. It should be, talking about what are the needs, right? One of the big things too is resources, ensuring that there are enough resources, because the government system, it doesn't have the resources, right? And so it goes back to this thing that you mentioned where we have to feel like we have to be strong and we have to get the work done and all these things, as opposed to the structure saying that, we can only go as far as we can go. We can only do as much as we can do. And that's okay. That's okay, right? So it's putting in that structure to ensure that the supervision is for the caregiver. Being in social work and in therapy and things like that. That's a major thing that I focus on, which is your mental health. What are the things that you need? The reflective supervision, making sure that there's a safe environment where you can have that peer support, peer supervision, and things like that. So I think to ensure that what you're saying, Ms. Marcy, happens is to make sure that the environment is a safe environment for the caregivers.
Excellent conversations around burnout. And all of these are so valid. And I think that going back to what Ms. Marcy said about, there's this buzzword now, we're hearing more and more about burnout and compassion fatigue. But what are actually the signs? How do we know if someone may be going through burnout? How do we know if our personal experiences, if we're feeling the effects of burnout? So what signs do you both look for, or someone could look for in themselves or others, that may tell that someone's going through burnout, secondary trauma, or emotional exhaustion from caregiving roles?
I could definitely share. I have gone through burnout a few times, that compassion fatigue. And one of the things that I've noticed with myself is the mood swings, right? Where I would feel like I would become very critical, very pessimistic, right? That's definitely a sign. Becoming irritable with my colleagues, becoming irritable with my clients. And so being self-aware, again, is so important. Being able to identify, like Ms. Marcy said, is so very important, right? And what's also another sign is being detached from your family and your friends. It's like you're so depleted, you feel like you just want to go home and Netflix or stay in bed or something like that. And I always talk about being active in your self-care. So to the very thing that we need to do to work through a lot of the emotions that we're going through, which is being connected, right? Being connected to our loved ones is the very thing that we end up detaching from when we're going through that compassion, fatigue, and that burnout, right? I think another symptom too is addictions, right? Ways of coping, self-medicating in different ways. That's something that's very serious. And these symptoms are all very serious because if they're not checked, they can really lead into that depression, that PTSD, and then the productivity, right? That's a telltale sign your productivity goes down. There are many times where when I was burnt out that I would come to the office and I would just sit at my desk and not do anything because I just had no energy, I had no focus to be able to keep going, right? And then, just physically just being tired all the time, and in seeing these things, thankfully I had supervisors who created that safe space where I was able to go and talk to them about it. And based on that conversation, I was able to do things that I needed to do to look after myself. Yeah.
So for me, what I have observed and what I've experienced too, when I started personal level first, when I first experienced burnt out, it was because I was having physical symptoms. So I kept on having like panic attacks or anxiety. So my breathing would be very I always like I had moments where I felt like I couldn't catch my breath. I sometimes thought that I was having like a heart attack, and like something was really drastically wrong. And then I wasn't getting a lot of sleep, so my mind would just keep running in the night, thinking about what I didn't say, what I didn't do. Because a part of burnt out also is a part of what you did not say. And let me explain. So a lot of times we have these feelings or these thoughts, or we're in situation where we should have be assertive rather than passive, and we did not be assertive. And when you suppress that, it can lead to a whole heap of issues. So for me, I kept on in the night just rehearsing what I should have said in the moment when I should have said it, or what I should have advocated for when I should have advocated for it. So, and then that going on and on. So I had those moments, and then similar to what Odana shared, the low energy to do the work. But mine was more disguised, I believe, because I would have been able to do the work, but it was when I got home, like I had low energy to engage with my kids. So my kids require a certain level of energy level. So it's being able to be engaging with them and having the conversation and playing. I had such low energy to do that. And that's when I was like, you know what? Yeah, something is wrong. So I started to see physical symptoms. I was not paying much mind to the emotional, mental symptoms, even though they were very much there. I did not pay attention to those at first. So it was when I started to recognize the physical symptoms, because sometimes burnout manifests within like illnesses. So some people will end up with headaches a lot. They would, the same panic attack, anxiety attacks. Some people end up like really sick. They just keep on getting sick because their immune system is low, because stress creates those kind of issues. So you could have those physical symptoms, but it's also the emotional and the mental state. So a lot of what Onana shared about your thought patterns, how you engage with people. I remember I just wanted to isolate. I didn't want to engage or have the fun moments with my family, which is what they're used to. So you tend to want to isolate and just kind of practically lick your wounds. So it's either doing things that are either self-sabotage. You self-sabotage in a lot of ways where you do things that are not healthy for you, and they affect you or those around you. So burnout could take, like you can see the symptoms in various ways. It has a variety of symptoms, some that we might not even be mentioning right now, some that are not even recognizable in some people. But it takes a variety of symptoms when it comes to burnout. I remember when I went to the doctor, thank God that doctor was not just focusing on the physical. When she started to ask me questions, I got emotional in the consultation room, and she looked at me, she's like, okay, let's talk about this. And then she started to ask some other question, and she's like, yeah, it sounds way more like you're burnt out. Because also being very emotional can also be another way of showing signs of being burnt out. Like, I remember I was at a point where I feel like I would have cried for everything and anything, because you have a lot of suppressed emotions and feelings and thoughts. So it definitely takes different forms, and it looks differently for everyone, like for the expressions.
And I'm really happy that you mentioned that, because I think that's why having peer support systems is so essential, because you can be a supervisor, but you're taught that you need to get to know your workers, but the peers, right? The social workers amongst themselves may know each other so much better than the supervisor, would know the direct report. And so, like you mentioned, it can manifest in so many unique ways that peer could be able to pick it up much quicker than anybody else. And so again, it goes back to creating that safe structure there. And the nature of burnout and compassion fatigue, like you mentioned, is that it can lead to, again, these very chronic conditions. So mentioning again the depression that will come up, the PTSD, and then looking at maybe more physical in our culture, again, right? We have high levels of hypertension and diabetes, heart disease, and things like that. So, what's that connection there? More than likely, there is a connection, because some of these things are caused by high stress, and compassion fatigue and burnout will lead to stress, right? So looking at all these things, putting it all together for the sake of the caregiver is so important, so that we can have a healthy workforce as opposed to a very sick workforce.
Yeah, I think I think even within our country, a lot of time people are just walking around with a lot of stress. And sometimes it's systems issues. Like sometimes people coming into certain settings are wanting access or wanting services, and it's like they just feel like everything is stuck against them, and there's no break or opportunity for them to access what they need. Those things can also lead to parents being burnt out. You have X amount of children, finances are low, you're trying to access support. Support might exist minimal or non-existent. Or the barriers to getting the support, it's just too great. It doesn't even make sense to even make an attempt to get it. So while we're looking at workers as well, it's also the everyday person. There's various things that can lead to burnout. So for me, it's very important that, like, I have on my Facebook profile, I have Be Kind as my profile photo. And there's a reason why I left it there, because it's very important that we lead with kindness. Sometimes, even though we need kindness being shown to us, I feel like if everybody take that stance of leading with kindness, it will help us to pinpoint when people are really at their lowest point and not take certain reactions personally, and see if you are strong today, see how you can help that person in that moment. And then when you need the level of support, hopefully somebody is taking on the same mentality like you are and being able to extend that level of kindness or care. Because I feel like we are losing it, because it's so because like I spoke about the ripple effect, it's so rampant now that people are feeling overwhelmed. They're feeling down. And it might not be, some people, it might not be the workplace. Sometimes it's such system issues within, how things are going on right now, compassion fatigue. There's so much negative being pushed within the media. It can become so overwhelming. That can take a toll on people's mental health, especially if they're consuming it so much and so long. Like if you're binging on and reading every article, every issue, trust me, that's gonna affect your mental health, because we are not built to consume all of that. So that's why it's so important for people to take breaks and surround themselves in environment that will uplift and create ignite hope or feed the compassion and kindness. So for me, there's a lot of things at play. And while we're talking about burnout and compassion fatigue, it would be good for us to start looking at, all right, now how do we go about addressing these? Because it's becoming such a ripple effect now. I don't think people are looking at, all right, where do we put this stop, and now taking it seriously, because this is why we're seeing so much issues popping up relationally within the society. You're hearing murders, you're hearing the violence increasing within relationships and so forth. And I think it has a ripple effect of all of these things. And I'm happy we're having the conversation right now, because I think we really need to take stock at how not taking care of people, or how to put in the various things in place for people to access care because they're giving care, so that they don't fall away or collapse or turn into something that they're not supposed to. So if we don't put a stop and put in the various structures or care in place for people who provide care, I feel like we keep on getting a ripple effect going on. Because right now, if you look at some systems, we could clearly see some workers are there, caregivers are there, but are they really providing proper care? They're just barely giving care because they themselves are in need of care, and there's no care being provided for them. So we see where that then trickles down to poor services. So people are going to caregivers for care, and they might be getting abused or some malpractice happening or something. So that is some of the issues that we see coming up when we don't really prioritize caring for caregivers, because it definitely trickles into every single thing after that.
Marcy, I think that... Go ahead, Onando.
Sorry. Sorry about that. Dr. DeGare, something you had mentioned maybe a couple of years ago, you shared something that said everybody is doing the best that they can every day. Like every day, people are doing the best that they can. And so I fully believe that caregivers are doing the best that they can every day, right? With the lack of resources, with the toxic work environment, with the heavy caseloads, they're doing the best that they can every day. And so definitely I like what you mentioned, Ms. Marcy, about, how do we work with this now? How do we make this better? How do we work on this issue? And I think it definitely goes back to having these trainings, having workshops, more and more of this to empower the very caregivers so that they can be compassionate to themselves as well, so that they can, as you mentioned, identify it, right? See it, be kind to themselves, so that they don't feel like they have to fall in line with a toxic work environment that is saying, oh, you're passionate, okay, that's why you're here, so you got to do the work, you got to keep pushing, so on and so forth, right? The caregiver with the knowledge can then say, this is all that I can do, and that's okay. And that's okay, right? And then that giving them that level of education helps them to advocate more, so that they can advocate within their spaces to ask for the different things that are needed for their self-care to prevent the burnout, to prevent the compulsion fatigue. And I think that a lot of supervisors also need this type of training as well, so that they understand how to have more informed supervisions with their staff. Like I mentioned before, so that they're pointing out different things, right? there are trying to identify different things with the worker so that these things can be addressed as quickly as possible. I'm happy to say that the Employee Assistance Program is something that exists where government workers, free of cost, can access counseling services. There's also the Counseling Services Unit that is free of cost as well for the public, offering counseling services as well, where these things can definitely be identified when you're working with a therapist. These things will be identified and work can be done to look at active self-care, working on the different things that an individual needs so that they can work against the burnout and work against the compassion fatigue. As I mentioned, I tell my staff all the time, be active in your self-care. Don't just go home and sit in front of the TV or in front of the phone. Be active in your self-care, because we're beings that need to be connected. We're beings that need to be talking and interacting and these things, right? And so then if that works for you, then that's what you got to do. Or if nature, I have a therapist working with me, and her thing is every weekend going out into nature. That's how she recharges. And I love that for her. And Belize is the best place for that, right? To go and recharge and things like that. So it's about advocating for ourselves. Like our caregivers, we as caregivers, we have to continue to advocate for ourselves. We need not be afraid. We need not be shy. We have to be brave and advocate the same way that we advocate for our clients. That's something that many people within the ministry have spoken about, that we're so big to advocate for our clients, but then we're not advocating for ourselves. And it does feel kind of scary, especially if you're in the government and you're afraid of losing your job and things like that. But being strategic and working with your peers and things like that will get the job done, will get people to listen, and incrementally we'll get to where we need to get for our own self-care.
We touched upon a lot of topics here. One of the big ones is recognizing that burnout is not just our mental health. There's physical symptoms and conditions as well. And I think that's one that may go unnoticed for those who just hear this new buzzword of burnout, right? They may not actually put the pieces together that, oh, I'm getting stomach aches every time I go to work, not because of what I ate last night, but because of my burnout, right? Or headaches or whatever it may be, right? So that's really important part of our conversation, is recognizing that burnout has a multitude of symptoms and doesn't look the same for everybody. But also this idea of how do we almost revolutionize the work environment to recognize that 100%, and I tell this to my clients who come in with burnout into my office, 100% does not equal everything you can do, sacrificing your health, sacrificing your mental health. 100% is everything you could do while also being healthy in those areas, right? So reinventing this idea of what does it mean? What does it look like to be a good worker, a good caregiver? And I know there will be some supervisors and those, big important people watching this, and really understanding that you can drive that change in your work environment. You can create a place where vulnerability is a strength and not a weakness. And it has to start with us. So thank you. These conversations are so important. For the final question, and these are my favorite types of questions because we know anybody could be tuning in this evening. What would you say to a frontline worker listening this evening, maybe a police officer or a social worker or a nurse or a doctor or any type of caregiver who feels exhausted or unseen right now? What would you say to them?
I think for me, what I would say is, I see you. I hear what you're not saying, because what you might not be saying is very tough to say or acknowledge. But I would encourage you to be honest with what you're feeling, thinking, and if it requires you to reach out to get the help or reach out to get the pause, you would need to do it. If you can't do it, it would be good for you to either go to someone who can help talk you up to a point where you can, if you could write it, because some people are more comfortable writing it out, and give it to who needs to see it. But I think my appeal would be more to those who are overseeing caregivers, who are in the role that can support caregivers. I would really appeal to whether it be supervisors, organizations, bosses, whoever it is, that can really look at your policies, the structures that you have in place, and really see if it supports people who are experiencing these things. And if it doesn't, then please, whatever it is that you need to do to support and put it in writing or in policies or whatever it needs to be in for these kind of care to be in place. These safe spaces to be in place for people to not be penalized when they're not well. Please do that, because for the sake of the country, the sake of services, if we don't do it, we're going to keep on having broken systems. We're going to keep on having people just doing bare minimum. We're going to keep on having the ripple effect of people injuring people, people hurting people. It's going to keep on happening. The cycle will just keep on happening because we are not taking the necessary step to ensure that the right care and that these things are being addressed in the way that it should be addressed. So my appeal is more to those who have the power to shift the narrative and shift systems and shift policies and structures to ensure that we have these embedded for people to have these moments to get help, and not just help without judgment, help without rejection, help without condemnation, and where they can also heal in the process so that they can come back and provide the proper care and services that they very much so are willing to provide.
I would want caregivers to feel what they're going through and to accept it because it's okay. Whatever it is that they're feeling, that they accept it, right? It's very important that they're open to all of their emotions, right? And for caregivers to believe themselves, to believe what they're feeling, to believe what they're going through, and to believe in themselves that they can make that very change. The very fact that we're in many of these different professions is the fact that we are capable and we are constantly changing other people's lives, empowering other individuals. And so it's for the caregivers to believe that you can do that for yourself as well, right? And that you can have the conversation with the supervisors, you can have the conversation with the CEO and the minister and all these individuals to let them know, right? To let them see you, as Miss Marcy said. And definitely, I agree with the idea of having the supervisors, the managers who are seeing this, to go back to the drawing board with regards to caring for staff. Many staff in these professions are living paycheck to paycheck. Many of them are not doing well financially, emotionally, physically. And so it's important that we get back down to the ground and we have those conversations with the very workers that are in our organizations, right? To really connect with them, to continue to get to know them, and creating that safe environment, fighting tooth and nail to create a safe environment for our staff because they deserve it. And again, they're in the profession because they want to do the work. So if they want to do the work, let's create the safe environment for them. Let's fight for that. Yeah.
Excellent. Caregivers out there, you are not alone and you deserve the same amount of empathy, care, and respect that you give to others. Thank you to the both of you for joining us tonight and engaging in these important conversations that I know we could probably talk for quite a much longer, many more hours about this important topic. But I hope you all, viewers, who tuning in live or watching the recording, continue to have these conversations, continue to speak up for your needs and your needs of your staff. Thank you for tuning in. Thank you to the both of you for giving us your expertise and time. And until the next time, thank you for joining us.